Namaskara. Ahara Arogya Adhyatma, the light of Samskara. Welcome to it. Today we have a renowned orthopedic surgeon, Dr. Vinay Kumar Swami, who was a brilliant student, studied in Bangalore Medical College, and then did his MS in orthopedics from Banaras Hindu University, and also got a fellowship in the sports surgery from United Kingdom, Manchester. And he has done more than 1,000 cases of knee replacements and the knee. And welcome, Dr. Vinay.
Thanks, madam. Thank you very much for the invitation. I'm glad to be here.
Yeah. Last time you explained about the osteoarthritis and the knee joint and how the person suffers and everything. And now please tell us, what are the indications for the knee surgery and what are the contraindications for the knee surgery?
Knee replacement, you mean, no, madam? Knee replacement surgery. Yeah. Normally, we speak of arthritis as being in 4 stages or 4 grades. Grade 1 arthritis is when the arthritis is just starting. That is when there is something called as cartilage. The cartilage will be completely intact, and gradually the cartilage will start getting worn off. This is how our normal knee joint is. The blue thing is the cartilage. So when it starts wearing away, the blue thing is lost and becomes red. And the joint becomes rough. The last stage of arthritis or stage 4 arthritis is when the arthritis is quite extensive. The whole of the knee joint is involved and all the cartilage is lost. So a knee replacement surgery is indicated for people who have stage 4 arthritis. And those are the ideal candidates for knee replacement surgery. And it does not mean that everyone who has stage 4 arthritis has to undergo a knee replacement surgery and there is no other option. We always consider knee replacement as the last option. Whenever a patient comes to us with a knee pain, first we give them medications for arthritis. We ask them to take physiotherapy. We ask them to try to reduce their weight, become a little more active. We give them some braces. When all that has failed, only then we suggest a knee replacement surgery as the last option.
Okay. Now, what are the contraindications? The real obesity or diabetes or any other thing, is it a contraindication or they are only relative contraindication?
Obesity is not a contraindication at all. A relative contraindication if the body mass index is more than 35, which is an extremely obese patient. Obesity is a vicious cycle. What happens is because they are obese, they don't exercise much and they develop arthritis. Because they have arthritis, they put on more weight and they develop even more arthritis. So we've got to break that vicious cycle somewhere or the other. So we can't expect someone who has severe pain in the knee to exercise and lose weight. So we got to at least relieve them of their knee pain so that they can exercise and then lose weight. Obesity is definitely not a contraindication. About 90% of the surgeries of knee replacement that we do are on people who are obese. Diabetes, which is not controlled, is a definite no-no for any surgery, any elective surgery, not just knee replacement surgery. If they are diabetic and it's not well controlled, we don't ask them to undergo any surgery, which includes knee replacement surgery also. We diabetes is under control, the wound healing is as good as wound healing for a non-diabetic person. The other contraindications are skin problems over the operative site. Active infection around the knee is when we don't do a knee replacement.
In other words, you are saying that the person who has got obesity and then the arthritis, it's a vicious cycle. By doing the knee replacement, you make it as a virtuous cycle. That means they start moving without pain and then they lose the weight and then they become slim and trim and nice. So you are literally changing the vicious cycle to virtuous cycle. Excellent. So can you explain us how exactly you do? Is it a partial knee replacement or a total replacement? Which part of the joints you replace? You please explain to our viewers.
Yeah, we had discussed about which are the cases which are good candidates for a knee replacement surgery. Those are all candidates for a total knee replacement surgery. When a person has stage 4 arthritis, that means the entire knee joint has become arthritic, and that is a patient who has to undergo a total knee replacement surgery. Knee in front of us, and this is the patient's left knee. This aspect of the knee. This is the inner aspect of the knee. This is
Okay.
called the medial condyle, which is the inner aspect of the knee. This is the lateral condyle or the outer aspect of the knee. When a patient has arthritis of both the condyles, then they are the patients who have to undergo a total knee replacement surgery.
Okay.
A partial knee replacement surgery is done for people who have only arthritis in one compartment. The medial side or the inside of the knee normally takes about 60% of the weight, and the outer aspect takes only 40% of the weight. So
Okay.
this is the condyle which undergoes arthritis very early. So
Okay.
most commonly, partial knee replacement is done for people who have extensive arthritis of the medial compartment alone. And what we
Okay.
do in knee replacement surgery is this. Knee is a complex joint. It has three bones. It has the leg bone, the thigh bone, and the kneecap. If you see that from the side, you'll find out there are three bones:
Oh,
the thigh bone, the leg bone, and the kneecap. There is an additional called fibula in the
fibula.
joint. It does not take part in the formation of the knee joint, so we don't touch that.
Okay.
That is
Okay.
not a cause for the knee pain also, because it's not a part of
Okay.
the knee joint only. So
So it is
generally,
only
these
holding
three
the
bones,
ligament. The ligament is attached, but it is not part of the knee joint.
it is not a part of the knee joint.
Knee joint.
Yes, yes,
Yes.
yes.
Okay.
This is a model of a knee replacement.
Hmm.
Uh, in knee replacement, we replace the thigh bone, which is the femoral component, and then the leg bone, which is the tibial component.
Okay.
You can see a metal here. You can see, because
Okay.
this is the model, you can see the part that is buried inside the bone
Bone.
also. We put something called as a bone cement here and fix it there.
Okay.
If we have two metal components, historically we've understood that does not work well. The metal components come out and they cause a lot of friction and early failure. So
Okay.
we have inserted a ultra high molecular weight polyethylene here in between the two,
Okay.
so
Okay.
that it is a much bearing surface and it lasts for a long duration of time. So the three components of a knee replacement are the femoral component, the tibial component or the leg bone, and the ultra high molecular weight polyethylene.
Okay.
Kneecap is replaced in about 10% cases.
Okay.
Because for us to replace the kneecap, normally you need at least 24 millimeters of the diameter of
Okay.
kneecap, because we will take
Okay.
off 8 millimeters,
Okay.
and at least 60 millimeters, 16 millimeters is required to hold our knee replacement
Okay.
component.
Okay.
This one does not have a metal backing, it is only a ultra high molecular weight polyethylene.
Okay.
These are the parts of a total knee replacement when we replace the
Okay.
whole knee joint.
Okay. You said that ultra molecular is thing, the bearing portion. So
UHW,
yeah.
yes, yes.
Okay. And now the God has given that inborn with us, and that lasts for 100 years. What about your material that you have put? How many years does it last?
If what God had given lasted for 100 years, then we would not have any work at all.
That's a
what
very
what
intelligent comment. Okay.
what God has given sometimes lasts for 80 years for some people, lasts for 35 years for some people. We've done
Okay.
knee replacement surgeries for people who are 35 also.
Okay.
So the knee
No,
replacement
that
that
is
we
the
put in
reason I
gen
asked, if you have done at 70, that's okay. But if you have done at an earlier stage, because of injury or accident or something. So how long does this total knee replacement last?
usually the follow-ups, we have the average lifespan of a knee replacement surgery is around 20 years now. So it may
Oh,
last anywhere
wow.
between 18 years to 25 years. And
Hmm.
there have been people who outlasted their knee completely, and it's gone on beyond 30 years also. The
Great,
minimum is
great,
around
great.
20 years on an average.
But that is more than enough, if the 20 years of pain-free walking and then keeping themselves fit itself is a boon to the patients. My last question to you is, what is the cost of this implant now? Now,
The
why I'm asking
Yes.
this question is, there was a time when Modi ji, he asked Anand Kumar ji to cut down the cost of stent and the implants, because he didn't want the older people to have the burden. So even our coronary stent cost capping was done, and also for the implants. And that's the reason I'm asking, what is the cost and how much the patients have to bear?
The cost of the knee replacement surgery after the central government ruling has come down significantly.
Okay.
It was more expensive earlier. There is something called as NPPA policy. After the
Okay.
NPPA rule came in, knee replacements became much cheaper, and a lot of patients benefited from that. So the
Okay.
current price is around 70 to 70,000 for a leg replacement surgery.
very.
Needs are more also.
Yeah.
If we are doing something called as a revision replacement, then we have to add additional components. But a basic knee replacement is around 72,000.
No, that is fair enough. It's quite reasonable. And more than that, they have Ayushman Bharati also, and they can apply for that also. And so many other schemes are there. So thank you very much, Dr. Vinay, for explaining so beautifully with the models. And even a person like me could understand. I'm sure all the viewers are very happy with your description. Thank you very much.
Thank you very much for the opportunity. I'll always be delighted coming on to your show, and hopefully we'll be able to educate many people and bring them out of this stigma of or the fear of surgery. Knee
Absolutely.
replacement surgery, uh, successful surgery, very predictable surgery, and most patients improve after good knee replacement surgery.
Yeah. So you have removed all the fear from their mind so that, instead of suffering with the pain, they can come and get the surgery done and then be happy and lead a very wonderful life. Thank you very much.